Hello guys, welcome back to my YouTube channel. From this video, I am going to discuss about high blood pressure or hypertension. This is an important medical condition nowadays and also one of the most common problem we can see. Also, hypertension can cause or it can progress into serious organ damage if it is untreated. So before discussing about high blood pressure or hypertension, let's see what is blood pressure and how blood pressure occurs. This diagram demonstrates very clearly how blood pressure is measured. You can see the sphygmomanometer is there and you can see the heart and you can see the patient's arm. When the heart pumps blood towards the throughout the body, it distributed throughout the body via various pathways. Those pathways are called as blood vessels. Mainly blood vessels are two types as arteries and veins. Arteries are the blood vessels which carry blood from the blood away from the heart, and veins are the blood vessels which carry blood towards the heart. So you can see an artery here, and this artery continues as brachial artery. So you can see the blood pressure cuff of the sphygmomanometer is kept over the brachial artery of the patient, and also the stethoscope is kept over the brachial artery. This is how blood pressure is measured. And when the heart pumps blood and distributed throughout the body via these blood vessels, blood inside those vessels exerts a force against the wall of those vessels, creating a blood pressure. And this is the value we get through sphygmomanometer. When we measure the blood pressure, we take the readings as two components. The above value 120 is systolic blood pressure and the below value 80 is the diastolic blood pressure. Systolic blood pressure is the pressure exerted on vessels when heart pumps blood, and the diastolic blood pressure is the pressure exerts on the vessels when the heart relaxes. So there are normal ranges as well as the ranges which we call as high blood pressure. You have to know what is the normal blood pressure range and what is the range for high blood pressure, because in this table you can see various blood pressure values for systolic blood pressure as well as for the diastolic blood pressure. The normal range for systolic blood pressure is from 90 to 120 mercury millimeters, and the normal range for diastolic blood pressure is 60 to 80 mercury millimeters. We call as elevated blood pressure when the systolic blood pressure is 120 to 129 mercury millimeters and the diastolic blood pressure is less than 80. We call as high blood pressure grade 1 or stage 1 high blood pressure when the systolic blood pressure is in between 130 to 139 mercury millimeters, or diastolic blood pressure in between 80 to 89 mercury millimeters. Stage 2 hypertension is when the systolic blood pressure is 140 or more, or the diastolic blood pressure is 90 or higher. The hypertensive crisis means in that stage you have to consult your doctor immediately when the systolic blood pressure is higher than 180 millimeters mercury and or diastolic blood pressure is higher than 120 mercury millimeters. This diagram also clearly says the two components of blood pressure, the systolic blood pressure and the diastolic blood pressure. The systolic blood pressure occurs during systole or when the squeezing of the heart, the force and pressure exerted on vessels during systole, and the diastolic blood pressure occurs during diastole or during the decompression of the heart. Pressure exerted on vessels during the diastole or when the resting phase or the relaxing state. And this graph shows how the blood pressure fluctuates or changes throughout the day in an individual. The causes can be differ from person to person, and those causes can be the strength of the heart pumping, blood volume in your body, and the resistance in the vessels. These are the common symptoms of high blood pressure or hypertension. If you get in dizziness, recurrent headaches, nose bleeding, and shortness of breath, you have to meet your doctor immediately and check your blood pressure. This picture also shows the common symptoms: nose bleeding, headaches, chest pain, blood in urine, shortness of breath, vomiting or nausea, palpitations. That means you may feel your heartbeat goes faster, and dizziness, blurring of vision. Those are some of common symptoms of hypertension. This diagram shows how hypertension occurs. You can see a normal blood vessel and you can see the prehypertensive stage and the hypertensive stage. During the hypertensive stage, the blood vessel gets narrows. And when we talk about the causes, uh, we can mainly divide this hypertension as primary hypertension or the essential hypertension and the secondary hypertension. In the 90% of population have primary hypertension or the essential hypertension, which there is no underlying cause, which is characterized by no clear cause, and it can be idiopathic. The secondary hypertension occurs for the 10% of the population, and it occurs due to an underlying cause. It can be due to various endocrine causes like pheochromocytoma and various other causes like thyrotoxicosis and renal artery stenosis, like that. The Although there are no clear underlying cause for the primary hypertension, there can be risk factors. That means old age, obesity, salty diet, sedentary lifestyle, drinking too much alcohol, and genetics contributes to primary hypertension. Some of these factors can be prevented, like you can prevent getting obesity by maintaining the your BMI within normal range, and you can have low salty diet, and also you can do regular physical exercises, and you can engage in day-to-day activities, encourage in day-to-day activities very actively, and you can stop drinking too much alcohol. And those factors, if you prevent those factors, you can prevent getting primary hypertension as well. There are very serious consequences of high blood pressure also. When the sustained high blood pressure in arteries, it can cause damage to the wall of the blood vessels, and also hypertension can impair the function of endothelial vessels, and it can cause cascade of events, and also it can increase the levels of reactive oxygen species, which can damage the cells and tissues further, leading to heart attacks. And also high blood pressure can trigger inflammatory response in the body, which can contribute to organ damage. If affects the brain, we call as a stroke. It can be intracranial bleeding or ischemia. And also not only it cause damage to heart and brain, it also cause damage to kidney as well. It can cause renal damage, and also it can cause peripheral vascular disease as well. So this is how the hypertension mediated end organ damage causes. And this is that that's all about high blood pressure or hypertension. Hope you gain clear knowledge about what are the symptoms and what are the normal ranges and what are the causes of high blood pressure. And thank you for watching.